Welcome guys, it's your registered nurse Ovie. In today's video, we'll be talking on the conducting system of the heart. The conducting system of the heart simply refers to the ability of the heart to generate its own impulse in order to keep the heart in a continuous state of contraction and relaxation. Now, the ability of the heart to generate its own impulse is referred to as autorhythmicity. So, autorhythmicity, like we say, is the ability of the heart to generate its own impulse. And this autorhythmicity is carried out by some specialized cells which are referred to as the sinoatrial node, written for short as the SA node, the atrioventricular node, that is the AV, written for short as the AV node, the atrioventricular bundle, also called the bundle of East, the atrioventricular bundle branches, that is the branch of the atrioventricular bundle. And lastly, we have the Purkinje fibers. Now, these are the specialized cells that are responsible for the autorhythmicity of the heart, and they are found within the muscular layer, that is the myocardium, within the heart. As you can see from this diagram here, each of them has their various function. Now, talking about the conducting system of the heart, we'll make a sketch of the heart in order to show the explanation of it. Now, if we have a heart to be in this form, if this is our heart now, and we bring it down and split it into, now this is the left and the right side, and we split it into the superior and the inferior part. Now we have the four chambers of the heart represented on this diagram, which are the right atrium, the left atrium, the right ventricle, and the left ventricle. The first of which is the sinoatrial node, which will be written for short as the SA node. The SA node is located on the superior lateral wall of the heart, of the right atrium, immediately underneath the superior vena cava. So we can place our SA node on this part here, immediately after the superior vena cava. This is the superior vena cava, that says VC, and this is where the SA node is located within the atrium. Now, the SA node is also referred to as the pacemaker because it generates its own impulse, and its impulse is about 60 to 100 beats per minute, BPM, and the impulse from the SA node causes contraction of the atriums, that is the left and right atrium. So it is sent to the walls of the atrium to cause contraction. And when this impulse is sent now, it is sent to the atrioventricular node too. Now, talking about the atrioventricular node is located along the septal wall, that is the wall of the septum, which separates the heart into the left and the right side of the atrium. That's along the septal wall of the right atrium, immediately above the atrioventricular valve. Remember that it is located above the atrioventricular valve along the septal wall of the right atrium. So the AV node, now also called the atrioventricular node, is located on this part, and it also has the ability to generate impulses too. But the impulse of this AV node is low, but it only comes into action when the SA node is 40, and the impulse of the AV node is about 40 to 60 beats per minute. When the AV node generates impulses, this state is referred to as the bradycardia because the impulse is very low, it is less than normal. While when the impulse from the SA node is above 100, it is referred to as what? Tachycardia. Take note of that. So the AV node now, on generating impulse or receiving impulse from the SA node, after the contraction of the left and the right atrium, the impulse is sent into the AV bundle. Now, the AV bundle lies within the septum, that's within the septal wall. That's where the AV bundle is found, and then it gives off two branches, which are the left and the right branches. That's the AV bundle branches, which comes this way. One comes this way, and the other one comes this way into still within the septum. Now, after they've gone downward to the tip of the heart, that's to the apex of the heart now, it gives off two branches. which are each of them now goes within the ventricular walls, that is the walls of the ventricle, and this branch which goes into the wall of the ventricle, they are referred to as the Purkinje fibers. The Purkinje fiber causes the contraction of the ventricles, and once its impulse is sent, there's contraction of the ventricle, which allows the ventricle to empty its contents into the pulmonary artery or the ascending aorta, whichever one that arises. Remember, impulse from the SA node causes contraction of the left and right atrium, causing it to empty its contents into the ventricles, and impulse from the air goes to the atrioventricular node, then to the bundle of His, and from the bundle of His to the AV bundle branches, and from the AV bundle branches, that's left and right, it goes to the Purkinje fibers, which causes contraction of the left and right ventricles. So this is a sketch of the conducting system of the heart, an overview of it. Now the heart rate can be influenced by several factors, even that is the nervous system and the endocrine system. Even when the impulse is not generated from them, they affect the pulse rate, and the part of it which affects part of the nervous system which affects the heart rate, that's the number of times which the heart beats, are referred to as the autonomic nervous system. Autonomic nervous system, which is divided into the sympathetic and the parasympathetic nervous system, while the endocrine system, some hormones from the endocrine system such as epinephrine and norepinephrine also influences the rate of contraction of the heart. Remember, the impulses are generated from the heart, but the rate at which it occurs might be influenced by the nervous system or endocrine system, and this will bring us to the end of the conducting system of the heart. Thank you.